the LCSR Ask Victoria Q&A webinar. A few housekeeping issues such that everyone has been placed on mute, so that if you want to ask a question, you can use the icon in your dashboard to raise your hand, and we can unmute you and let you speak. Otherwise, while we're presenting, if you would like to, you can enter your question into the question box, also on the GoToWebinar panel. And then we can read your question out loud and present it to everyone in the forum. Today I'd like to present a live demonstration of some of the forms that you've already seen, some of the data entry that you might be struggling with, and also some additional resources. I did want to preempt some of the questions to address the CMS requirements, Medicare requirements, and reimbursements, as these will not be discussed in today's session. We have an entirely different website and webinar which is designed and presented by our economics division. They have their own FAQs, and also it's headed up by Anita McLaughlin, so that if you have the questions about your Medicare patients and reimbursements and how does this data tie in together, and if any of the data is missing, how does this affect your reimbursement, those questions would then go to a different person, and I've provided their information here. I've put together a slide deck of 21 slides so that when we've completed the webinar, I can send these to you, and you can use the links and also listen to the webinar again if you'd like to. So, getting started, I thought we would go through just the different styles of submitting data, most especially because as you received an email last week, we're running into quarter 3, which is the beginning of July, so July 1 through the end of September. All data that's been captured by your facility through the end of September should be entered into the LCSR registry through your registered facility. And if you have multiple registered facilities and a master facility, I need to let you know now not to enter any of your data into the master facility. All of the data has to go to the specific facility that the screening image originated at. So if you have follow-up information to a screening, then you would enter that at the child facility ID level. And we can go through some scenarios on what to do if you entered information at the wrong facility, how to get it from there to the right facility within your master child registration. You can perform a manual data entry, which is probably the most used format for submitting your data. We'll go through that in detail and your questions. There's also the flat file upload. There are specifications and they are provided in our user guide, and I'm providing a link here for that. So for the flat file upload, we have specific information in Appendix 1, 2, and 3 that directs you through how to configure your computer or your laptop so that your file can be delimited with the vertical bars. And then also the position of each data field and the condition under which the data needs to be submitted. And that's called a business rule. Not every cell within the template that we offer is a free text cell. We need for you to make sure that your responses are appropriate to the business rules, and we can take a look at that a little bit too. I get questions a lot, and I'm shifting here a little bit to the data entry. What is a reconstructed image? What are you looking for? What is the time current? I'm sorry, we were going through this yesterday. Some of the CTDI vol questions and the DLP and related questions to the actual image. If you're not certain where to find that information on the scan itself, we also provide a bit more of an explanation in the data dictionary, what it is and where you might be able to find those data elements. I've also included here, because this is also a common question, is what are the minimum data elements? And we do have an actual minimum for a successful submission of data. This minimum, and I want to take a look at it now, takes a look at the minimum requirements according to the CMS for your Medicare patients and what the CMS is requiring, and then also the minimum requirement for participation within the lung cancer screening registry. So what we've done is we've broken these two requirements into two tables. The very first table here is data to be sent to the CMS every quarter. I'm asked that quite a bit. How often do we submit Medicare patient data to the CMS? And it is quarterly. So it is a rolling quarter. So every time you submit data, we are updating them with that information. So it's not just data within those 3 months, but all the data that has come in before that period of time as well. So when you get an opportunity, you can look through these particular data fields and then also the more granular data that they're asking for as well. So you see this CTDI vol down here and indication for exam and so on. If you come down a little bit further to the second page, these are the additional required fields. These are required by the Lung Cancer Screening Registry, which is us. We collect more than the required minimum by the CMS, mainly because this is a clinical, it's a registry where we're looking at more than just the Medicare patients, but we're also looking at non-Medicare patients and how the screening affects early detection of lung cancer and lung disease. How is it effectual? There's a lot to consider, and so in order to look into those particular questions, we collect additional data, and you'll see here that the additional data may look like the follow-up diagnosis, a tissue diagnosis, tissue method, and so on. So we do collect a great deal more data. All told, we collect 84 data fields, and not every patient, of course, is going to be able or would even qualify for all 4 data fields because they may not need follow-up exams, and that's where the bulk of our data is coming from. I want to look at the user guide fairly quickly. This is a tool that I think many of you are familiar with, but it doesn't contain all the FAQs. In fact, it contains only a few. We try to capture as many as we can in the user guide and then conduct these webinars on the side to augment what's in the user guide. And if you feel there's a way that we can enhance the user guide to make it a little more friendly, certainly submit your suggestions and we'll review it to see if we can include that in this particular document. This is really kind of our go-to document, at least it is for me. And if I can simplify some of this information in here, I certainly will. Looks like it's taking a little bit of time to load. What I also want to do is get to the portal, because we're going to be looking at logging in. I'm going to log in as though I am a registry administrator on our test account. So what we're going to look at is simply test data. It's not real data, so I don't want anyone to feel alarmed by that. It looks like our user guide is still loading. Here we go. I'm going to just reduce that screen a little bit. The user guide does, I want to just look at the table of contents. Here it's our forms and data dictionary information here, but specifically today we're looking at data collection and the various ways to collect that data. You can see that a great deal of time and effort has gone into explaining the manual data entry process, how to complete each of the different sections, and we'll look at that in the live demonstration, and then how you can go back and find a form, either an exam form or the registration form, and edit that case or even cancel a case. And we do not delete data, but we can certainly make sure that the case is canceled. And when it's in a cancellation status, it does not get sent to CMS and it does not get incorporated into your quarterly feedback reports. For the flat file upload, again, I explained that we do have appendices 1, 2, and 3, but there's also a little bit of information here on page 26 that explains the actual flat, how to upload a flat file once it's been configured. And then the reports. I'm going to go through the reports in the slide deck. I've got it a little more laid out for you. This is probably just I think a little less condensed than what I have. So we've got, let me see if I can get here, our very first appendix, which is how to convert your LCSR upload template to a .txt file. This link will take you directly to our template where you can begin to populate this template. It looks as though it's an Excel file, but it isn't. We'll look at this. All right, I'm going to go back to where I started. And what it is it's actually a .csv file. And a .csv file means that we've kind of taken one extra step out of the equation. The Excel file, which can contain formatting, we took that out. We got rid of the Excel template and we replaced it with a .csv file. It will not retain formatting, but it will retain your data, and that makes that upload process that much easier. And I'll show that document to you here, and then I'll also correct the link in my in my slide deck. So here we are on the lung cancer screening page. This is a resource page for you. It's sponsored by the NRDR, which is us. And you'll see here it is 3 links down, the upload template for the record layout, and it will try and launch again as an Excel document, but when you go to save it, you'll see that it is a .csv file. So when you expand the columns, you'll see that you need the unique identifiers, and these are explained in great detail in Appendix 3 of the lung cancer screening, the lung cancer screening user guide. So once you've populated this and you've begun your upload process, if you run into any errors, certainly contact us and we'll review your upload through an audit log and see if we can't work with you to correct that template, especially before the deadline, which is at the end of the month. If any of you would like to work with your certified vendors, these are increasing almost by the month. There are more and more vendors that qualify and certify, and they have to go through authentication and testing with our IT department. So these have been vetted, and you can work with them. They have different pricing structures. We don't carry their pricing structures, but you would have to click on the link. It will take you to their web page, and you can get the information from there. With that, I want to go to our login page and begin a demonstration. This is under the assumption, this presentation is under the assumption that you have certainly registered facility and that you also have rights to log in as a user. Now, the lowest user, the lowest user type is actually as a facility user, and I would prefer that you not be registered as a facility user if you're going to assist in the lung cancer screening process. If you're going to add data, you can be a facility user, but if you have to go back and edit that data, a facility user type that low won't allow you to edit any of the forms that have already been created. So if you have a facility user type, ask your facility administrator for that particular account to change it to registry administrators so that you have as many capabilities as is possible. You not only can initiate the forms process, but you can go through and edit them and add information as it becomes available to you, such as biopsy data or a pathology report. You may want to go into the exam form and begin to populate section B with that information. All right, what I'd like to do is maybe start to take some questions about some of the data entry perhaps problems or issues that you've been running into. Lou, if you get an opportunity, you can unmute someone or read the question.
We have a question. I'm afraid I've been entering all data for facility. Can you tell us where you find parent and child facility information? Is there a way to easily remedy this issue?
Where to find that information? Well, you'd have to have a list of all your facility IDs. There isn't an easy way to find all of the related facility IDs. If you're not certain what all your facility IDs are, send us an email to nrdr@acr.org. Give us at least one of your facility IDs, and then we can run a query and look at all of them and then send that back to you. The answer to your question about moving data around, if you already have data that's been submitted to a particular facility ID, you would have to cancel that data and then log out of this particular facility ID and then log into the correct one and add the data there. So there really isn't an easy way to move data. The way to cancel data that's been submitted is to do it working backwards. It's a two-step process. You would find your patient, and then you would open the exam form first. And once your exam form opens, you would scroll to the bottom and click cancel. And once you've been able to, and here we go, I've got my exam form open for this particular case. Go down to the bottom and then click cancel. That will cancel the exam form, which is one part of the total case. The case is made up of two forms, the registration form and the exam form. Now that you've canceled the exam form, you want to find the exact same case in the registration table. We're going to go to the registration table and find the patient here. Got the number. You open this up and you do exactly the same thing. So you click on the case number, you open the form. Once it launches, go down to the bottom and click cancel. Once you've canceled both forms, you have then put the case in a cancellation status. And here we go, we've got cancel. And when we get back to the top, you can refresh your page. I like to just refresh it by clicking on the registration link again so I can get back the table. And in the table here, for this particular patient, you can see that the case has now been canceled. Next question.
Okay, let's see. I noticed that you're using the September 2016 edition of the user guide. The user guide on the website is for January 2016. When will the new edition be available on the website?
I'm sorry, I'm using a older, let's see, the user guide here. The most recent or the latest edition should always be on the website. Sometimes there are browser issues where it shows the last version instead of the most recent version. Let's see, I'm using Internet Explorer at the moment. It's probably a better idea to use Firefox. But the answer to your question is the most recent version is on the website. It's not been taken down.
Next question.
Next question.
If you are using a database such as InVivo or Primordial, do they provide automatic registry entry?
Registration? No. No. You have to register your own facilities, and you have to be able to provide them with your automatic. I guess I don't understand the question. I'm sorry. Each of the certified vendors, yes, it does say September 2016, but that is the most recent, so I can double check that though. All right. Each certified vendor, as I said, has been authenticated. And with InVivo, I'm not certain which type of data extraction they're going to perform for you. They need to be able to perform a minimum data extraction. And the minimum data extraction, or the data fields, we just went through in the required data elements. They really should be able to, and I can verify this a little bit later after the call with our IT department. So I believe each and every one of these vendors can submit all 84 data fields. Now, how they do their data extraction, and if they're using your risks or your billing or an EMR, EHR, it's entirely up to them how they want to perform that data extraction. And it's also up to them how they're going to submit the data on your behalf. Some of these vendors will do the data extraction, and they will put the information in a flat file upload and simply present it to you, and you would do the upload portion. some of these other vendors will do what's called a web-based submission, where they would call using an IP address, call to our central server, and then submit data via the cloud or the web. And it doesn't require a flat file upload. It's an entirely different function. I hope that helps. Next question.
When we add an exam that requires a follow-up, do we submit at the end or save and leave it in progress until all follow-ups are completed?
No, you don't want to leave it in a saved status rather than a submissions, or you can see the different status here. There are some that are in progress. In progress, for us, when I look at a case that's in progress, I think of it as incomplete data. The minimum data requirements have not been met. That's why it's in progress. These forms, when you start a new case registration, you should have the data for the minimum data requirement. I'm going to open the form. I'm going to show you how you can know it's a required data field. Each required data field has an asterisk beside it. If you don't have this information or you cannot provide an answer, you will not be able to go to the bottom of the form and submit. It will only allow you to save. So if you're able to submit and advance to the exam form, you should fill in all the information that you have for the screening exam and submit. Once you've done, you perform the submission process using the submit button, we're able to use that data to do two things: incorporate it into your feedback report, which again is quarterly, and then also, if it's a Medicare patient, the only way we're going to know it's a Medicare patient to send to CMS is to complete this data field here. So if you do have that number, we expect you to provide it so that we can then send that over to CMS, and we roll that up and send it every quarter as well. So the screening information should be entered as soon as you can enter it. We say at least monthly, but there's no mandate. We have absolutely no mandate on when you should be submitting data. It would behoove you to submit it as soon as you can. And then when you have follow-up data, go to the exam form, which is where you're going to enter that follow-up data under Section B. Enter the data there. You won't submit anymore because the submission really is for the screening. The button at the bottom will then be Save. So when you enter the follow-up information, go to the bottom. Here's Section B for follow-up within a year. Expand it. Start a new record. Fill in the required data fields. And I do get this question fairly often. For any follow-up images, do we need a new long RADS? No, you don't, not for this. Can a follow-up image be a low-dose protocol? Yes, it can. Can it be a routine? Yes, it can. And then you're done. That's all we need for the follow-up images. So if you have an image that's 6 months out, we go ahead and retrieve, or we ask you for the date of that image, when it was performed, what type of image, and then go to the bottom and then save. You'll see that the submit button, which is normally over to the right, is gone. So we want you to submit your screening data first and then come back and populate with your follow-up data later. And at the bottom it says case data saved successfully. Next question.
We have a hand, so I'm going to unmute Kristen Lahana so you can ask your question.
Okay.
Kristen, are you there? Kristen, would you like to ask your question? Okay, I'm going to move on to Shauna Nybert.
Okay.
Shauna, you are now unmuted. Would you like to ask a question?
Hello.
Hello.
I have can there be more than one administrator?
Facility administrator? No, but there can be an unlimited number of registry administrators.
Okay. And when I look up in our hospital system if they're a Medicare patient, you want like even we don't always have, like if they would have Security Blue Medicare. It's a different, we don't always have their regular Medicare Beneficiary ID. You just have the Security Blue information. So I don't know if I'm supposed to put that in there. You know what I'm asking?
Right, yes, I do. And I do get that question quite a bit too. If they have Medicare, we need their Medicare ID. It's usually the Social Security number followed by a letter.
But,
right, some letter. If you find that you do not have their Medicare Beneficiary ID, I would go ahead and add the ID that you do have. Not for private insurance. This is not something I'm recommending for private insurance. I'm recommending this for any of the Medicare Advantage plans. It is passable that the CMS does have the other IDs for the Medicare Advantage plans. I think Humana has an advanced plan, and you just mentioned one. What we can do is ask you to submit that data here, and we'll try and get it over to the CMS, and hopefully if they have access to those IDs, they can then do a cross audit if they need to. It's important, though, for reimbursement purposes to make sure you're contacting that particular plan to make sure you're going to be reimbursed. We really don't know how the reimbursements will work for a non-traditional Medicare plan.
okay. We haven't run into any problems with that. But that's not the end of it. So I'm not sure.
Okay. Well, we're not sure either how the CMS plans to address those additional, insurances. But what we are suggesting so that we can help is that you go ahead and provide what you do know in the Medicare Beneficiary ID field, and then just come down here and click Medicare. If at some point in time you do know their Medicare number, I would go back and edit the registration and put in their Medicare number. And because we do submit every quarter, they'll get the updated information.
Okay.
Really, it's about your reimbursement and protecting your reimbursement. All that we can do is capture the data that you've given to us and submit it to CMS. Once we've submitted it, it's completely out of our hands. And so because we do submit data regularly, they will eventually get it. If not this quarter, then next quarter. I think it's important that they get the information, though, on the Medicare Beneficiary ID. Next question?
Okay.
Okay.
That's all I have.
Oh, okay.
Next question. How do you check to see if patient is already in the LCSR?
Okay. Well, you need to make sure if you have multiple facility IDs that you log into the correct ID. And you can run a list of reports. And I like this report option a great deal. It's the LCSR data export. The export will attempt to save 3 different types of files to your PC. And it's based on the different sections that we collect data. Either it's going to be in the case registration form, it's going to be in the case exam form, or within this exam form we have, which we just took a look at briefly, section B for follow-up. So if you're not certain if they've been entered into your particular facility, I would go ahead and do this export and then look for them. You can see here there's the first name, the middle name, and the last name. If you're not using names, then you really should be using one of the 3 key identifiers. One of our 3 key identifiers is a Social Security number. You can look them up by that. The other ID, which it's often a medical record number, but a unique ID that identifies your patient. And then if it's a Medicare patient, then there should be a Medicare ID number for your particular patient. Also, the date of birth would be a field you could use to locate your patient. So there are multiple identifiers here to locate a patient if you're not sure that they've been included in the data registry for your particular facility. I suggest to facilities to export this list and download it once a month just to review your caseload and cross-check it against the patients that have come in through your facility and make sure that they've been added. This is me, Victoria Jean O'Brien. So I've been added. So I use this as a way of cross-referencing. Next question.
Should the smoking cessation question be deleted if the patient isn't smoking anymore?
Well, that's curious. Deleted. Should the smoking cessation question be deleted? I'm not sure where you're trying to delete it from. If the patient is a former smoker, that information is captured on the exam form. So you would check mark in section A that they are indeed, let me see if I can find a case here. I'll use the first one. That they indeed are a former smoker. It is understood that they are, if they are a former smoker and if this is their baseline, they should have the smoking cessation performed. So we're going to do a former smoker, and this should, did the physician provide smoking cessation? It should be performed for the baseline. If it's a follow-up, it becomes, I don't mean follow-up, I mean the interval would be an annual screening. So if it's their second or third or fourth screening, the CMS is not requiring that you provide cessation guidance to the former smoker. So you can either click no or unknown, but there's no option for delete. So I'm a little confused by that. But at least within our data registry, these are your options for a former smoker. And of course, you know, make sure you enter the number of years since quit.
Okay, we have
Next question.
We have a hand raised. I'm going to unmute Arlene Morris, so you can ask your question, Arlene. Please go ahead. Arlene, you have a question? I'm going to move on to Beverly Weaver. Would you like to ask your question, Beverly? Okay, we're not hearing Beverly, so I'm going to move on to more questions that we've gotten in the question box. If you have uploaded data using a flat file, do you add follow-up information on an exam form? So I'd like to respond to that. This is Lou Meyer, and regarding entering the follow-up information, you can enter it on the exam form. If you uploaded it using a flat file, you can either upload a new flat file with the follow-up information, or you can go in and enter the data on the website. So if you want to upload a new flat file, you have to make sure that 4 fields match the screening exam. Those are the 4 fields that the system uses to match the follow-up data with the screening exam. So those 4 fields are the patient ID, the Social Security number, and the Medicare Beneficiary number, ID that is, and the date of the screening exam. So those 4 fields have to match the original screening exam record in order for the follow-up data to be attributed to the screening exam. So those 4 fields have to be the same. So, for example, if you did not include the Social Security number when you added the original screening exam, then you must not provide the Social Security number when you're providing the follow-up data. So those 4 fields, the patient ID, the Social Security number, the Medicare Beneficiary ID, and the screening exam all have to be identical on the screening exam data record and the follow-up data. So if you left one of them blank, then you also have to leave it blank when you're providing the follow-up data. On the other hand, if you provided those data, then they have to match exactly. But you are free to go in and enter information on the web, even if you provided the original data using a flat file upload. Next question.
Lou?
If a patient is non-compliant with their follow-up, should we document that somewhere in the registry?
No.
I have a hand. Daniel Winkle has a question. Daniel, you're unmuted. Could you give us your question, please?
We're wondering if there's a packet available to provide to physicians for proper screening.
Proper screening. That's an unusual question. No, we don't have a packet to provide to the physicians for a proper screening. I'm a little confused by that question. What do you mean exactly?
Okay, so I'm sitting in for Dan. Not sure. He left us a list of questions to ask, and that was one of his questions. We have not begun to enter our data in, and I don't even know that we have our facility and information even started.
Mm-hmm.
So
Okay.
basically, he wanted to know if there was a packet that we could provide to our providers to make sure that they're properly screening before they send us the patients.
No, we do not have a packet, but I can tell you we do have some resources available for physicians, right? So if you were on our acr.org webpage and then on our quality and safety tab, and you went to our particular landing page for the data under the LCSR, towards the bottom, we do have patient-specific and physician-specific links. And this is a neat one. It's what happens next. This is just kind of I call it a flyer. It's a directional flyer,
Okay.
and it states a bit of a pathway. So if you start with a screening and the findings are thus and so, what's the next step? And so you can certainly present this link or this flyer to your physicians to look at, and it can guide them through the process of what they need to do next. There's also, and I'll show you the next one, there's also one that's very interactive, and your physicians can go through that interactive tool answering or asking the questions. They're more like an FAQ, and that might be helpful as well. This is taking a while to load. But while it's loading, I do want everyone to know that these decision-making tools are here for both the patients and the clinicians. And some of these are printouts and others are interactive. And they're really, really, I think, kind of neat.
We have another question with someone with her hand raised. Susan Tate Ivanovic. I'm going to unmute you, Susan, if you'd like to ask your question. Susan, do you have a question? Okay, we'll move on. If a screening patient is diagnosed with cancer and requires thoracic surgery, how long should I continue to upload additional imaging and CT exams?
Only within 1 year's time of the screening. I wanted to go back to the lady I was speaking with a moment ago. This page did finally launch. There's a great deal of information here with plenty of links. You can see this one is for patients, and this one's patients and healthcare professionals. These are downloads, and I really find a lot of this information to be very helpful for all the stakeholders in the process, the patients, the referring physicians. They've got a clinician's checklist here. I think that would be helpful for a lot of physicians, including the radiologists. I'm hoping the other one launched. It didn't. Okay, so, but at any rate, it is. I wanted to kind of get back to that and show you that there is material out here that I think your physicians and patients would be interested in using. Okay, next question.
Beverly Weaver, you have your hand raised. I've unmuted you. Would you like to ask your question, Beverly? We'll move on to Joan Souza. Would you like to ask your question, Joan?
Hi, good morning. Thank you. I uploaded a flat file, and some of the data on the CT dose was wrong. I had not put a decimal place in, so 3 patients, instead of having, say, 1.5 as the dose, they got 105. Is there a way to edit the data?
Oh, of course, of course. There's 2 ways you can do that. You can either submit a corrected file. So if you correct that data inside the flat file itself and then perform another upload, it will overwrite the data that we received previously. Or if you didn't want to do that and you had, like you said, just a few cases, go to the exam link and search for your case, for your particular patient, and open it. And you'll be able to edit any of those data fields. So you're saying the CTDI vol might be off. You can then go down to, you would be in section A, click Section A to expand, and then go to the CTDI vol area, and then provide the correct value. So CTDI vol here, sorry, I don't know, 3 or 5 milligray, and so on. If I go to the bottom and save, it's going to give me an error because I didn't put all the rest of the information in, but at any rate, you will be able to edit and save that form.
Could I also ask, would that be the same process if I wanted to add some data for a positive case and I now have the results of their biopsy?
Yes, yes, you would then, yes, you could, again, do another flat file upload. As Lou explained, you have to have the same 4 key identifiers. We can send that out in an email so that it's in print. But with those 4 key identifiers, you can create a second record and then provide the additional follow-up information in the required data fields. For this particular case, since I have it open, you would go to Section B and start a case record, start a follow-up record, and then enter that data there.
Okay, thank you very much.
You're very welcome.
We have a question from Stephanie Daniels. Stephanie, I've unmuted you. Would you like to ask your question? Stephanie, do you have a question for us? Okay, another question. This is apparently in reference to a previous question. I apologize for the Medicare ID number. If they have a Medicare replacement, HMO, PPO, do we use that information, or is it just for traditional Medicare patients that they want data for?
I'm assuming they is in the CMS. We're not certain. As I said earlier, for any Medicare Advantage plan or a non-traditional Medicare number or count, I would say, just to be overly cautious, add the Medicare number that you have. So if it's an HMO, PPO, I don't believe that's considered private insurance. So go ahead and enter the information of the ID number that you do have. We'll submit it to the CMS and we'll let them make the final determination. But one thing I did state earlier that I think is really important is with the Medicare Advantage plans or the non-traditional plans, please contact their benefits and make sure that the screening is covered so that you're reimbursed. So again, if you have a traditional Medicare Beneficiary ID, enter it. If you don't, but it's a Medicare Advantage plan, go ahead and enter that ID. We'll accept it and we'll submit it to Medicare on your behalf or to the CMS on your behalf, and we'll let them do what they need to do with that information. It's the best we can do under the circumstances.
Next question, what do we enter if we do not have a Medicare ID?
You enter nothing. It's required that you answer, though. This really should have been stated as a question. None or refuse to answer, question mark. Well, if you have none, then it's yes, and then you would notice down here, if you click yes, the field is blocked. You'll not be able to enter Medicare Beneficiary ID. Now, if you have a Medicare patient and you do not have their ID, we're not going to be able to send this data to the CMS. So I would heavily suggest you get the Medicare Beneficiary ID and change your selection to no, because you now have the Medicare Beneficiary ID, and enter it, and then go to the bottom and save your form. This is the only field that we use to know that you have a Medicare patient. And that's the only field we use to indicate that we should roll up the data and submit it to the CMS. So if you want it to get to the CMS, we're going to need that Medicare Beneficiary ID. And if you're not certain about the Advantage plans, go ahead and put that ID in there, and we'll send it anyway. Next question?
The next question is a follow-up to a previous question. The previous question was not how do we know if the patient is in our data section. The question was, how do we know if the patient is in the LCSR? So
you can't know, I don't believe. But go ahead, Lou. Go ahead.
No, I just was going to repeat it because it's in a couple of sections. So the question was, how do we know if the patient is in the LCSR? The question was not, how do we know if the patient is in our data section?
Okay. I don't know that you really can know. We don't display patient information to a facility that did not do the data entry. So if the patient is in the database, unless you're using the Social Security number, and even if you are using the Social Security number, I don't believe our software will let you know that the patient is in the database across all the facilities. What we can do with a Social Security number, if you continue to use that, is link patient information together on our end, on the back end, but it's confidential information, and it's confidential to the facility that's actually performed the data entry. No one else should have access to that information, so you won't know.
Next question. What if they were first screened at a different facility altogether and then had a follow-up screening at our facility?
Okay. Well, there's one of two ways to answer that question. If the facilities, these multiple facilities, are in the same healthcare system, sharing the same digital information through a RIS, EMR, EHR, etc., that's an easy answer. If they have a follow-up at your facility, but the screening was performed at a separate facility within your healthcare system, that follow-up information should be sent to, it should be entered under the facility that performed the screening. So the follow-up should follow the screening. Now, if it's outside a healthcare system where you don't share the same information electronically, then there's really nothing you can do with that data, the follow-up data, other than provide that data to the patient and have the patient submit it to the screening facility. Or if you have a disclosure in place that the patient is signed, that you can send the information back to the referring imaging facility, and your permission to do that, then you can send it to the imaging facility. The final question, the final answer really is, we cannot accept follow-up data without a screening in place. So when you perform a case registration, a new case registration, it is to enter the information from a screening initially. You go to the bottom and submit. Follow-up data then can be submitted on the exam portion of the form under Section B. But this form cannot be used for simple follow-up information without screening information to precede it. So it's either lost to follow-up, so to speak, under that expression. You can't enter the data at all, or in some manner you can get the data back to the imaging facility that performed the screening. And if you're in the same healthcare system, that's easy. Next question.
There are plans that are by private insurers that have been chosen instead of the standard Medicare plans. For example, UPMC for life, MC, HMO. So, would this coverage be considered Medicare or private insurance?
Well, I think if it's a Medicare Advantage plan, I believe it's considered Medicare insurance, but I really am not certain. I think that information, if you're not certain, please go back to this particular email that I showed earlier. I'm going to send this slide deck to you. Send your question about coverage to this particular email address, and Anita McLaughlin will get back with you. I think I've answered that question 3 times now. If you're not sure, contact that insurance company to check for benefits to make sure you're going to be reimbursed and that particular procedure is covered. If you're not sure to whether it's a Medicare or a Medicare Advantage plan or private insurance, take a chance, put the ID in the Medicare Beneficiary ID field that I've showed several times, and we will submit it on your behalf. We cannot guarantee reimbursement. That's not what the lung cancer screening registry is for. It's not a platform for CMS reimbursement. Next question.
In the histology section, the option to enter data is quite different than a histology lab report.
I'm sorry, what about the histology section? I'm going to the exam form now.
I think this is more of a comment than a question, simply stating that the option to enter data is quite different than a histology lab report.
Okay. I'm not sure what to do with that. If you want to elaborate in a follow-up question, you certainly may.
Is the match to existing and uploaded data based on NPI?
A match to existing data?
Yeah, I think this, it sounds like this question is, might be going back to the previous question about follow-up data. The match is not made on NPI. It's made on the 3 patient ID fields and the screening date. So the next question is, we use CAD at our facility. We think this might be a good data element to include in the questions. Any thoughts of doing this? Include
in which questions?
I think it just means in general to include information, have that as a data element on what we're asking for.
Oh, I see.
Yeah.
Yeah, that goes, yeah. Any additional data elements to be captured must be vetted through our lung cancer screening committee members, and I believe really regularly, and will consider any new data elements at that time. Next question?
Why would we need to enter Medicare ID if you have the date of birth, name, and social security number?
Because the CMS is requiring it for one, and then for another, it is the data field that we use to identify a Medicare patient so that we can roll up that data and send it to the CMS. I've said that a couple of times now. That's why we collect that data. One, it's required by the CMS. Two, it is required by us so that we can identify Medicare patients, roll up the data, and submit it to CMS quarterly.
Further clarification on the histology question. Histology lab would be as G1, G2, G3, G4, but the guideline to enter histology data is 1, non-small cell, 2, high-grade 3, 3, low-grade 4, intermediate, which are not the lung cancer's G1, G2, G3, G4 grading. Would you please explain?
I'm not certain what there is to explain. These designations have been created, and I think what you're referring to is the flat file upload specifications in the business section, or the business rules, which is Appendix 3. It might be. I'm going to guess. So for the flat file upload, you do need to provide the numerical equivalent. If you are uncertain what the numeric equivalent might be, then perhaps leaving out that data altogether would be beneficial. We would rather have the data, though, since it is histology data, and perhaps have a radiologist, or I'm sorry, a pathologist reinterpret that for you.
I'd like to add that the data elements and the way they're described on the forms were indicated by the Lung Cancer Screening Committee. So
Right.
Victoria and I don't really have a lot to offer in the way of explaining why they are the way they are. But as Victoria said earlier, we'd be happy to pass on to the committee any suggestions that you have. So if you think that it should be phrased differently or the data should be represented differently, well, we'd be happy to take that forward. And that also applies to the previous question about having a question about CAD or any
Right.
other improvements that you have in mind or that you'd like to suggest. Please feel free to pass them on. You can send an email to nrdr@hcr.org or to Victoria directly, and we'll pass on your suggestions and requests. Another question. I'm looking to clarify. Are you saying that smoking cessation education is a requirement for CMS payment, even for former smokers?
All CMS questions should be, CMS questions really should go to Anita McLaughlin. And I'm going to provide her email again here. The resource which I'm referring to is in the CMS final decision memo. And you can get to that memo from our webpage. This is a link at the top of our lung cancer screening registry. The the CMS.gov webpage. It will launch and it'll go directly to the lung cancer screening information. Once the page launches, I'll show you where you can find the decision memo. It's the very first link here, decision memo for screening with lung cancer and low dose. In these requirements, they state specifically what is required for former smokers and for current smokers regarding smoking cessation. And the information is broken apart into the baseline screening requirements and then subsequent annual screenings. So the language changes between the two. The baseline screening, there are mandates, and for former smokers, they do need to receive the smoking cessation. However, let me go for this here. If you notice here, for the initial lung cancer screening service, these requirements must be met, and then for subsequent lung cancer screenings, these requirements must be met. So if you do a search on this particular page for smoking cessation, you'll find all the information that you need with regard to that. All right, so that's where I pulled that information from, this particular part of the page. But again, if you're feeling as though this is difficult to interpret for you, or you want some assurance, you can then contact Anita at this particular email, and she can provide you with that assurance. Next question.
I have an audio question from Susan Tate-Patanovich. Susan,
Okay.
Would you like to ask your question? Susan, you have your hand raised. Would you like to ask your question? All right, next question is, I've noticed that the patient ID has dropped off the online registration form. For example, I've located a previously registered patient by searching with the Social Security number for lookup. It will pull up the record but does not provide the patient ID.
Right. We've removed the patient ID from the lookup. You're absolutely correct. We would like for, it's not removed from the records. You can do a search for it, but if you're entering a case, a new case, perhaps the patient is coming back, they're a returning patient and they're coming back for their second screening or a third screening, we want you to use one of the 3 primary key identifiers to search for that patient and not use the patient ID. These are identifiers that we also use in the flat file upload. So you can see here we've got the Social Security number, the Medicare Beneficiary number, and the other identification number. You enter your numbers and then perform a find. It will look for that particular patient, and then we'll import that patient's information into the new case. You can see here the test data, of course, is myself. It's imported what I call a patient profile. It does not import anything more than patient demographics. If I had entered, say, a birth date, that would have been saved as well, patient sex, and so on. This will give you also the opportunity to add information and then add the new exam date. And then you can go to the bottom and save or submit, whatever the circumstances might be. I'll caution you, though, when you do have returning patients that are coming back for, again, their second or third screening, please don't populate this form until you've used the search bar and the patient information has been found and has been imported into your document. Otherwise, you'll get an error at the bottom of the page that says duplicate Social Security number. So this happens quite a bit. Folks won't use the search for existing patient bar. They'll simply go here and start typing in a Social Security number, begin their typing, and they get to the bottom and they get an error that says, duplicate Social Security number. So don't enter the data. Look for your patient instead. And yeah, let's see if that says submit. Okay. Then add your additional information. Next question? Yeah, okay, there we go. I was able to generate the error. So don't do your typing ahead of time. Find your patient, import the patient, and then populate with additional information and update the patient's profile that way.
This is a referral to a previous question. By proper screening, my guess is he's referring to making sure referring providers are referring patients who appropriately meet criteria and also completing the shared decision-making visit and all that is required for that.
Okay. Well, I'm not certain how you want to conduct that investigation, but according to the CMS guidelines, the order from the referring radiologist should contain, it says written orders for both initial and subsequent should contain the following information. So in the order itself, it needs to contain this information here. There are some physicians that are referring professionals. It can be a PA, an RN, or a physician who can write the order and then include this information, of course. And then some of them go an extra mile and then attest that the patient has received the smoking cessation, they are free and asymptomatic of any signs of lung cancer, and so on. We do have some forms that are on our resource page here, and these are samples of order forms. Let me get to the order form samples, just a moment. Oh, I'm sorry, suggested order form information. So we've captured the data elements that the CMS has required and put them in this particular document. And then beneath this particular document, we have either electronic samples of an order form or the hard copy. Okay, here are the information that we've extracted from the CMS to make it a little bit easier. And then we have the samples, and this is a sample order form that was provided to us from Dr. McGee in the Leahy Clinic. The highlighted fields are here, packs per day, etc. But they've also gone to the very bottom and included by signing this order, you are certifying that, and then these, the specific information according to the CMS, and they've included, of course, the statement that the patient is asymptomatic. They've added some of their own symptoms, such as fever, chest pain, shortness of breath. I think cough has been addressed, and weight loss has been addressed specifically by the CMS decision memo, but you'll find that this particular physician added additional symptoms and has attested that the patient does not have those symptoms. So CMS requirements are stated in their decision memo here. And if you have questions about that particular order form, which should be included or how it should be attested to, you can also, again, send that email to Anita McLaughlin. She can walk you through what would be required of you as an imaging facility, and then also any additional questions you might have about the order form itself. Next question.
If your facility is using an approved database such as Primordial, do we have to do any of this, or do they take care of it for us?
Primordial, I don't believe, does it for you. The approved database, according to CMS, is not referring to the mechanism in which you extract your data and then submit your data. They're actually referring to any facility such as the ACR, and you'll see that we're listed here, that has gone through, we are a database that can warehouse your data that's been submitted to us, and then also meet the additional expectation, which is to submit the data to the CMS. So the answer to your question is, well, no, Primordial cannot do this for you. So far, the American College of Radiology is the only approved lung cancer screening registry, meaning it's been approved by the CMS. And until there are other databases that are approved by CMS, we're the only one so far. Next question.
Can we enter CMS required data initially and return to enter additional ACR data at a later time?
Well, yeah, of course you can. It depends on what you're trying to achieve, though. In order to submit your form, which means being able to click at the submit button at the bottom, you need all the required data fields. So any field with an asterisk needs to be provided. So if you do provide us with only partial information on the registration form, you'll not be able to submit. You must be able to provide all the data required on the registration form in order to make it over to the exam form. And the exam form is where the lung RADS designation can be entered and so on. That's where we capture the exam data. So at least for the registration portion, you need all of this information. So patient security, one of the key identifiers here, and so on. So you can always enter data and come back. You can save it and come back and edit that with more complete data. If you cannot submit the form, meaning if you cannot click submit at the bottom of the form, we're not going to be able to incorporate your data into a feedback report, the quarterly feedback reports, and we will not be able to submit your data to the CMS when it comes to the exam portion. We will certainly submit this data to them, whatever you provide, but this form won't advance you to the exam form unless you have the required data. So it's kind of a yes and no answer. Next question.
Is there an easy way to find patient to enter follow-up information without looking through registration like a search button?
Without going through the search function on registration? I guess I'm an easier way than this. There are really only two ways that I know to look for a patient. What you're wanting to do is to find the patient because you want to enter more data, then this is the only option you have. Because what this search will do for you, especially if you want to add the follow-up data, the follow-up data does go in section B on the exam form. You'll click here on the exam form and either enter the case information, like the case ID. All the case IDs are down here, so if you've recorded the case ID, you could type that in there. Or you can simply do a search for any case status that's in progress or completed, and perhaps then the herd that way, or enter the patient ID or patient name or patient last name. This is case sensitive, so if I'm looking for myself and I know I've entered my name with capital letters, then it will locate all the patient information. I've entered myself several times on several case numbers. You really shouldn't do that. But this is test data, so that's why I have. But this is case sensitive. So I'm not sure what other options you're looking for to locate your patient, but if the idea is to locate your patient in order to add data, this is the search function that you'll use. You can even look for your patients according to the physicians that did, the radiologists that interpreted the exam. Next question.
How should I handle a 6-month interim exam, not baseline, which was done late, over 12 months from the original screening? Should it be entered as a new annual and not as a follow-up prior to screening?
If it is not a screening, you do not enter it as a screening. End of story. So if it's well beyond the 12 months, you can enter it. You can still enter that data into Section B of the exam form for that particular patient. The data beyond 12 months does not become incorporated in the feedback reports. And if this is something that may indicate the cancer has been detected, this will not go to the physician's benefit in the cancer detection ratio or rate, cancer detection rate. So we're looking for data within 12 months. If it's outside the 12 months and it is not a screening, do not add it as a screening. Next question.
I missed the first part of the webinar. We have not been able to upload our flat file and have worked with our IT and still cannot. So if we choose to enter them individually on the website, do we, number one, register the patient as a new case, and then two, enter data under the exam? So it is a two-step process.
Yes, and Lou is correct. It is a two-step process. You would enter the new patient as a new case. Once you've entered the information for the patient according to the data fields in the new case, then you can click the Submit button, which will then advance you to the exam form. And then when the exam form launches, you fill in that required information and submit that form. So yes, it's a two-part process. Next question.
I'd also like to add that if you have trouble uploading your flat file, please send us a message at nrdr@acr.org and include your facility ID, and we'd be glad to work through the issues with you. The next question is...
I was going to say, we're getting down to the end of the webinar, so maybe we'll just take two more questions, and anything that we didn't get to, we'll follow up in an email.
Do we only enter follow-up data for the first 12 months post-initial screening exam?
Yes, with the caveat that you would enter follow-up data for any screening exam. Initial would suggest just the one time, so if it would be for all screening exams. If there is a particular finding and the physician feels the patient should come back in 3 months for another exam or image, then yes, that information should be added as a follow-up to that screening. So it could be the first, second, third, any subsequent screening. And one more question.
I just submitted 271 records from my facility and have also put all of this online in the register new case and the exam form and follow-up. I had no idea that I did not have to do both of these. Will that mess anything up since my information is in both places, doubled up? So the answer to that is no. It'll just, whatever you entered last will overwrite your previous data. So if you did the upload first and then entered data manually, the data you entered manually will replace the uploaded data and vice versa.
Okay, well, thank you very much for joining our webinar. Any questions that haven't been addressed, we will address those after the webinar. I'll also send you the 21, the slide deck. It's got additional slides in here that go through the things that we've actually been discussing, and there are live links that you can use. Also, the user roles about the facility administrators and so on. So thank you very much for joining, and I hope you have a wonderful afternoon.